Welcome to Free Summits TV. This is Frasier Lind, your host, and today I'm excited to talk to Norm Schwartz, MD. He's co-host of the Autism Intensive Expert Interview Series, a free online summit airing December 1st, where you can learn the latest science about autism spectrum disorders, including ADHD. Norm is an integrative medicine specialist with extensive postgraduate education and background in treating complex chronic medical problems. He has a special interest in helping individuals and families who are dealing with autism spectrum disorders. It's good to have you on, Norm.
Thanks so much, Frasier. Appreciate the opportunity to be with you.
So I know a child, the statistics now are a child is diagnosed with an autism spectrum disorder every 11 minutes, and currently 1 in 68 children has such a diagnosis. So it's definitely a ripe topic to have an event about. And my first question is, what sparked your interest originally in this area in your medicine?
Sure. Before I go into that, unfortunately, I have to say that we're speaking now at the mid-November, but there was just the latest release from the CDC 2 days ago that the autism rate is now 1 in 45.
Oh, wow.
Every 2 years, the CDC gives an update. There's always some question, is it more recognition, better diagnosis? But there's been 4 independent research studies that clearly point out that about 2/3 of the increase is a real increase. So, to me, it's a huge concern because the health of a nation is dependent on its children. And what we're seeing is not just autism, but increase in many problems with kids. But as far as my interest started as an integrative medicine, having training in traditional medicine, my background is a real science, as in physics, before I went into medicine. So we always look for fundamental causes. That's my training. And seeing so many chronically ill people that the pharmaceuticals were not helping, I started to ask more questions. And I had a child born in 1990, and he was actually somewhere on the spectrum, pretty high functioning. But so with my integrated medical background, with my interest in root causes, as far as what our goal is, not symptomatic consequences, I became more interested. And then I hooked up with a group called the Autism Research Institute. And through the late 90s and mid 2000s later, I attended many think tanks, Autism Research Institute think tanks, that would bring together parents, colleagues, who are practitioners and researchers. And we would sit down and think about how could we get this information out to people, because for something new understanding in medicine, before it gets into practice, can take upwards of 10 years. So the urgency was to get things that would help the kids. We knew a lot of the basic science. We knew a lot of dysfunction. Virtually everything we're doing is first do no harm in terms of nutrients, diet change, testing, how to get that out into practice. So being involved with that for now about 25 years, seeing a lot of results, it's challenging. We talk about treating and helping and recovering, not curing, because so many of the fundamental dysfunction in autism probably happens during development in the womb and then for several years later. And the key concept I would emphasize is that the cause of autism does not fit into our traditional reductionist medical model, meaning that for one kid there could be 5 causes, and for another kid there could be 5 different causes, and for another kid it could be 5 different causes. It could be starting during development. Remember that the nervous system develops the entire gestation, as opposed to organs which are certain windows, and then after birth. And one of the things I won't go into now, but it will be on our webinar and summit, all the things that have been associated with autism in the environment, and there are many, it's a long list. So working with colleagues and parents, and then seeing that we could make some changes and get a lot of good results has been very gratifying. When I met a few years ago now, Mike Mutzell was my co-host. He's a functional medicine consultant and author. His website, High Intensity Health, as a rep for the Zymogen company. But we had talking and realized there have been no autism summit. There are many summits out there. We thought it might be a good time to get this information to a wider audience.
So I know that the autism spectrum disorder now includes Asperger's and you're also including ADHD in the summit. Are there any other diagnoses or conditions that you're including and discussing in the event?
Right. So there's always a debate about where you would put a child. Asperger's was on the spectrum. Now it was included spectrum before the separate diagnosis. ADHD, there's some disagreement whether you would include it. We find that many kids who have that autistic label, when they improve, become very ADHD-like in their behaviors. Also, I would point out a very important thing to understand is that most of the kids on the spectrum, over 90%, are probably higher intelligence. I mean, kids that are nonverbal. So when you use a test for intelligence that's verbal, of course, kids are not going to score high, but a nonverbal testing, spatial orientation, other ways that can be done for IQ, many of the kids will be highly intelligent. And that's an important factor, linking the environment, because when your brain has to focus and coordinate things like speech, the membranes where the activity is happening on the neurons are very subject to environmental pollution because they have to be at a very fine point to transmit the neuronal signals. So they're easily disrupted by the environment. So that's an important point to keep in mind. In terms of what other things are related to the summit, it would be a wide range. There's different numbers. Again, 1 in 4 to 5 kids entering kindergarten has a mental health diagnosis currently. So for any neurodevelopmental behavioral issue in children, I think it would be helpful, but the focus is going to be on autism, Asperger's, with some overlap with ADHD.
Okay, I was specifically wondering about things like OCD, anxiety, sensory issues, things that are often either comorbid or related to the autism spectrum conditions.
Well, our focus will cover a wide range of issues in children. One thing to keep in mind that I also point out when we talk about cleaning up the diet, helping the gut, restoring nutrient balance, so many deficiencies are out there. This would help a wide array of things like anxiety, OCD, and sensory. What I would also emphasize, we have a fantastic group of experts. We have seasoned clinicians. Some, like myself, have been in practice 20 plus years. We have nutritionists who really help parents understand why the diet's important and how to do it. That can be challenging. Family with many kids, cooking. We don't like have people cooking 3 different meals, so we try and really get practical how to bring this change in an organized way, stepwise. We have researchers that have really talked about some of the core dysfunction biochemically in autism. Methylation is the big one. I would add that as a bonus, people who sign up would get a free access to a methylation summit that was done, I believe, last year with Ben Lynch, who's an expert in that area. So the range of practitioners, I think, is really helpful. We have body work therapists, a not banal method, chiropractic neurology practitioners, because we find that with the sensory issues, especially, a lot of body therapy can help the brain by seeing where a child's at in their developmental stage. Using body therapies that are individualized really can help kids improve and make progress.
That's really interesting. I've never thought much about body therapies in that for these conditions, and it does sound like something that could be helpful.
Yeah, no, it's a way to access the brain. What the practitioner does is see where the child is developmentally, in quote, normal development, and then assess that and be able to help that development, because the body does feed back into the brain. Your physical movements do feed back into the brain, so they're able to. And some kids make a dramatic difference. And again, those links and the practitioners will be interviewing Anat Baniel, who comes from Feldenkrais therapy background. Those are familiar with that. It's a very gentle way to rewire the brain, if you will. And she's applied that to assessing kids on the spectrum and other developmental disorders, problems like Down syndrome and cerebral palsy. Some really dramatic improvements have been documented.
So you've gathered so many experts from all these different specialties, and I think it really, you have a good set of perspectives to give us a complete picture of what's going on, or at least as complete as reasonably possible at this point in our journey of understanding these issues.
No, and let me just point out a few of our stellar presenters. There are many, but Martha Herbert is a pediatric neurologist at Harvard. She has an MD, PhD, and has done and continues to research autism. She's found some of the original findings about bigger brains in autistic kids that probably has to do with the brain trying to make connections to make up for the deficiency. And she's written a book, Autism Revolution. That's an excellent summary. She has 4 websites for folks to check out, but all that information and her research articles and the other presenters will be on the summit and be able to access, because I think that's really important. And it's mainly the parents who are doing this for the kids, and they're searching all the time. So we want to get the original research out to people, and there'll be hundreds of research articles from the presenters. Dan Rosenthal is another family practitioner, but research teamed up with other researchers and has published dozens of articles in the peer-reviewed literature about what can be done and how do you assess it, and biomarkers, and how you would start treatment. Jim Adams with the Autism Research Institute, his documents will be available at where you start with the child, because it's very complex. And then he's done, again, 3 published articles on nutrients in autism with positive results. And Sid Baker is a mentor and perhaps the grandfather of functional medicine. He's written many books and a lot of research articles. We'll be interviewing him. We have a 3-hour interview with him. It'll be broken up in smaller sections. And I would also mention Ken Bach. He's written a book called The New Childhood Epidemics, Autism, ADHD, Asthma, and Allergies, and it's been well received and experienced practitioner. Jeff Bland from the Functional Medicine Institute, another of the founders of the functional medicine practice and movement. He's interviewed and talks about his experiences. Then, as I mentioned, several researchers. Dick Deeth has done some of the original methylation research in autism. So I think would be a way for folks to really get the latest information, both the research and the practical, and supportive therapies.
Excellent. So it's geared toward both professionals and patients and families in terms of they can all get good information out of it.
Exactly. I know many of the moms are up late, sometimes dads, but usually moms up late online trying to get the latest information to help their kids. So it would certainly have that interest, I think, for a wide range of people. Practitioners will get a wealth of information and the links to the original research articles. I'm going to be offering an ebook on autism environment that will give detailed information about how to assess and what to do about toxicity. And then we'll have hundreds of links to websites, because there's so much good information now. Safer cleaning products, food, detoxing, water filters, cosmetics, a whole range of things that I think are part of this epidemic. There's so many little things that are building up. And you can do a lot to minimize it without too much trouble. So we try and simplify it. And again, give the information that's out there and resources.
Yeah, one thing that bears mentioning is that has been some controversy associated with autism, usually tied to people trying to pin one cause to it, when really it's a whole complex set of factors that play into it. So I'm glad that you're addressing it that way.
Yeah, and that would also overlap with the genetics issue. Many people aren't aware of it, but I would just point out it's perhaps a sad commentary. But when I was a medical student, somewhere in the dark ages, about 3 to 4 decades ago, what was taught was autism was caused by parents who were cold and unemotional, and there was even a term out called refrigerator moms. That would seem ludicrous today, but that's what was taught. It also was mentioned in my medical training maybe once or twice. So the research has been majority focused on genetic issues. I think it's clear, with billions and billions being spent now, that genetics is only a very small part. You can find some common things, but many of these overlap with environmental sensitivity genes. So I think that will shift. We're seeing it shifting to understand the environment connection, and that's a big focus. And as I said, ebook with the summit. We'll talk about that in detail and focus on what can be done.
Excellent. So I've heard from some people who are on the autism spectrum that they see autism as kind of part of who they are and not necessarily something that needs to be fixed. What's your response to that?
Yeah, no, that's very important. Many of the people who have been the greats in science and industry, technology, have been on the spectrum. So said Albert Einstein, failed algebra, probably because he knew more than the teacher, but he wasn't able to take the tests and do things as they were supposed to. Thomas Edison could hyperfocus, was probably on the spectrum. So we have to really look at that. I do think that's true. We're not trying to change anybody. I work with Down syndrome. We love the kids as they are. They're beautiful. They're perfect. There's no argument that there's anything wrong with them. The situation that I would point out, though, is if you have a kid who's not potty trained at 10 years old, is unable to speak, is in constant abdominal pain, is in the corner literally banging their head against the wall because they can't function or they're in pain, has fecal smearing, is running away all the time. This is not something that I think is good to continue. I mean, this, if I was a parent, is something I want to change. So that I would say the distinction. We want to bring all the kids up to their full potential. But if you have a kid that is, as I say, continually in abdominal pain, we call it posturing, they're pressing their bellies against the chair, they're in, doubled over on the floor. These are some of the severe cases. But this is not something I think we want to continue. We want to fix it. Many kids who are not verbal can be helped to speak. Methyl B12 example comes to mind. It's something that was developed by one of our practitioners. We're interviewing James Newbrander back in the late 90s, but he found many kids were helped by methyl B12. That's the form that actually crosses the blood-brain barrier and methylates the dopamine D2 receptor in the brain. It's often not functioning, so it helps the brain wake up and focus. So I think it was the parents' decision. We are consultants. We work with parents as colleagues. One of the things we emphasize is the phrase Dr. Mom and Dr. Dad. Let's face it, I have to say this, doctors have no special intelligence. We do have training and experience that I'm not minimizing. But a parent who's well informed can know more than a doctor about their child. So it's really up to the parents and the families. But we do approach them as colleagues, give the information, and see what makes sense for them to try for their child, but understand clearly that there's no attempt to change anybody or say they're wrong. It's really the functional level that we're focusing with. As I sit with the kids, I feel a connection to you, especially nonverbal kids. You can look in their eyes and see there's something really there, but it's not coming out. And as I said, my interest is what we can do to remediate this condition, and it is, I feel strongly, largely environmental, and we can do something about it.
Yeah, I myself, I had some digestive issues a couple of years back, along with some other symptoms. And when you're bloated and uncomfortable, and all those kind of things, it does distract you and make it harder to communicate and be functional in life. So I can only imagine what someone would experience having worse problems than I did at the time.
Did you treat yourself or did you see practitioners? Is that how you got involved?
I treated myself, pretty much transformed my diet and lifestyle, one piece at a time until I gradually regained my health.
Okay. But that's an example, I suppose. I'm not saying you're on the spectrum, but that it really has to be started at home with the basics. And yeah, if you're hurting and you've got dysfunction, brain fog, we haven't talked a lot about toxicity, being heavy metals or pollutants. Your brain's not going to function as well. So that's exactly where we can make big strides.
Yeah, I definitely agree, and it certainly takes a holistic approach.
Exactly, and I find more people are interested, so I'm encouraged. It's may be familiar with the tipping point. The good news is you don't have to have a majority of people to make change. It only has to be somewhere around between 9 and 11% in the research. So I do find more and more people I'm seeing in the practice are understanding the importance of diet, what you put into your body. What I find really tragic, I've had so many parents over the years say they went to their pediatrician, they're told diet does not make any difference. And the parents know that's not true because they've seen it. And there isn't that better research now. I do have that on my talk, and folks can access if they're interested, but it's actually an article by the American Academy of Pediatrics with the newer research. They say even we skeptics, referring to pediatricians who question parents, now have to admit that we may be wrong. So it's the American Academy of Pediatrics saying we may be wrong about the diet behavior connection. But obviously parents know what they see. And that's, again, when I emphasize parents are with their kids 24/7, they can observe things and see the changes. So I find that the parents are incredibly dedicated. And it's a challenge. And there are, good news is there are support groups, parent groups that are out there, and we'll have those listed on the website. Talk About Curing Autism Now, Generation Rescue, Autism Speaks, for examples of groups that have done really great work in supporting the parents and being able to bring the information out there. Safeminds does a lot of work on toxicity. So there's really good groups out there that we're connecting with and want people to know about.
Yeah, and another thing I was going to say is, as far as autism as part of one's identity, I really liked the analogy that Dr. Nancy O'Hara presented, where she said that your child is a gift as they are, but they're under several layers of wrapping paper that you have to peel off one at a time to get to the real them.
Exactly. And Nancy is a wonderful practitioner and person who I've known in autism research into think tanks, and that's exactly right. Well said. Thanks for mentioning that. The trailer's on the website that does highlight some of our speakers and a lot of wisdom just even on the trailer for folks to listen to.
So is there anything else you'd like to share about the event?
Just encourage parents to take a look. As you know, they're online free, and if interest, they'll be directed to websites and research. And my take-home point is that we can do something, we can remediate. Many kids improve. It's a challenge, but definitely something can be done and is being done, and we want to get the word out.
That's a very good project to be working on, and I'm glad you're able to bring all these speakers to us.
Great. Well, thank you for the opportunity to get the word out, Frasier. Appreciate very much talking with you.
Yeah. So for viewers, we have a link right under the interview where you can get into the event. Again, it's starting December 1st. So if you have an autism spectrum disorder yourself, or if you're a family member or even a practitioner, definitely take a look. Thank you for being on with us.
Best wishes.